we shall be discussing IVF treatment option for infertility. And to do justice to this conversation this fantastic day is Dr. Ify Atuchukwu, a medical doctor and IVF physician. So good to have you join us on the show, Doctor.
Thank you for having me.
And IVF.
Well, IVF is the full name for it is in-vitro fertilization. So what it is that it's one of the treatment options that you would recommend for couples who have some challenges conceiving. So what it does in essence is to try to simulate what happens naturally in a woman. So we know that from the menstrual cycle, at the beginning of the cycle, the woman will have a bleed. Mid-cycle, she would ovulate. And if there is availability of sperm, there will be fertilization. And subsequently, the embryos formed post-fertilization becomes implanted in the uterine cavity. So what IVF does is to simulate these three major processes, which is ovulation, fertilization, and then implantation. So the woman goes through what we call the controlled ovarian hyperstimulation. So what it does is that we give them gonadotropins, which are like hormones. So what the hormone does is to, instead of to release one egg as you would expect naturally, they get to release multiple eggs. Yes. So when they go through this stimulation, we retrieve as much eggs as possible, and in the lab we fertilize them either through conventional IVF or you do ICSI. Now, like you mentioned, ICSI means intracytoplasmic sperm injection. So where the sperm is manually injected into the eggs so that fertilization happens. Now, subsequently, when fertilization has happened, they undergo what we call cleaving. So they keep cleaving and dividing. So in the layman's word, they divide. So post-division, maybe on a day 3 or on a day 5, we then transfer those embryos into the uterine cavity and just hope that, of course, implantation happens. So basically, it's a process of ovulation, fertilization, and implantation. That's what IVF does.
How would couples prepare for IVF treatment?
Well, there will be an initial stage of assessment. So we encourage them to come into the hospital, yes, as a couple, and have, do the initial assessment. So we are checking things. We are taking blood tests to check for hormone profile. We are screening for infectious diseases. So we just do a general blood work. But prior to that, of course, you need to have a conversation with the woman. So you take a history. You're interested in her gynecological history, her obstetric history, her social history. A lot of us don't pay attention to the social history, but it's very important because it's from there that you would, know if she's had some bad habits that you will want her to stop, which we're still going to discuss further down. Okay, so after she's gone through that, she'll need to get an ultrasound done and some other procedures to get her initial assessment done. Then after that, we would converse with them. We'll want to make sure that they're eating healthy, they're having healthy, balanced diet. Because the saying is, you are what you eat. It's very, very true. So, and in some cases, we may even need to put them on some specific nutrition just to be sure that they are eating right. We'll encourage them to be a certain of an average weight. So you're checking their BMI to be sure that they are not obese or overweight.
Is it they now or she?
They, because it cuts across. Yes, we're talking about the couple now. Remember, both of them have come in.
Yes.
So if any of them requires to be placed on a balanced diet, they.
Why would a man's BMI be an issue here?
Because BMI
does it affect the what's the word now? The potency of the sperm?
Yes. So not just the man, it's the woman. So it affects fertility. The more your BMI, the less your chance of having a successful, procedure done. So, and by losing weight,
yes.
If, let's say for instance the woman, because usually they are the primary patients, if she's obese or overweight and she loses weight, it increases her chances of having a natural conception. Now, I'm not even saying about the IVF, so you can imagine it. Of course, it ups her chances of getting.
So we could even have a situation where you take them through the diet, she loses weight, and natural
yeah,
conception
there's a
just
huge
takes
chance
place.
that they
Yes.
can conceive naturally.
Yeah.
Yes, so yes, weight affects fertility.
Exceptional cases. I mean, the 4%, you could just be amongst the very 4%. So
Yeah,
it
totally agree.
is not a completely frustrated position or case. You could still give it a try, just in case you are above 40 or 45 and you still see a need to conceive and have children. You could still give IVF a chance, right?
Totally agree. So you will place IVF maybe roughly 1 million to 1.5. For us, is a lot. Not everybody has that amount of money, but comparing it to what we have at the other parts of the world, I mean, in America, you're having to pay at least $20,000 to have one IVF session done, and that's one. $20,000 in the UK, equivalent to what you have in the dollars, you convert it to pounds and you have to pay, and that's a lot. So I would say that considering what other people are paying in other parts of the country, it may not be that affordable for us, but I mean,
it's a way to go.
yes, it's a way to go. Boost their chances, and most importantly, we offer them emotional and psychological support. We can't even overstress how important that is. IVF may sound easy, but it is not, because a lot of women going through it are really emotional. So we have to be very empathetic with them and understand that the journey is not easy. So as physicians, it's also on us to encourage them in whatever possible and assist them in whatever possible way that we can. So literature says after 3 to 4 actually consecutive unsuccessful yes, you shouldn't bother. But that's what literature says. I don't kind of agree with that, because personally I have had patients that got pregnant at the 6th attempt, sometimes even 7th attempt. So even though it says after 3 to 4 attempts, there won't be any need to try, because your chances afterward has not been, it's not very positive. I would like to say, if you can afford it, why not? I mean, fertility is a basic human right?
Yes, it is.
Yes. So
it is indeed a basic
if you can afford it,
right.
go for it.
Defects?
Absolutely not.
Absolutely not. That is where we say thank you.